I've had more questions about GLP-1 coverage than almost anything else lately, so I want to get this information out to you fast. Because Medicare is finally opening the door for weight loss medications, even if you're not diabetic, and the monthly cost is way lower than people have been used to. Before everybody gets excited, I think there's some important details, a lot of confusion online, and honestly some friction that almost no one's talking about yet. Today I'm going to break down what the new Medicare GLP-1 Bridge Program actually is, who may qualify, what it could cost, what happens if you've already taken one of these medications, and some of the real-world headaches that people are going to run into. So why is this a big deal? GLP-1 over the past years has just absolutely been exploding in popularity. It's helped people lose weight. It also has helped people manage their diabetes. So I've been on one for a while, and I was borderline diabetic, probably closer to diabetic than not. And I'm now down to a 5.1 A1C. It's worked for weight loss. It also helped me bring my diabetes down. But also seniors have been hearing about Ozempic, Wegovy, Zepbound from TV, friends, doctors, social media, all of these places. And historically, Medicare has just not covered weight loss medicines when prescribed strictly for obesity. Many retirees and other people have been paying $800 to $1,000 or more a month just to get these medications when you're having to pay cash for them. For years, people have been asked the same question. If obesity continues to contribute to diabetes, heart disease, stroke, joint problems, sleep apnea, a lot of other chronic conditions, should Medicare eventually be paying for them? And why hasn't Medicare covered these medications for weight loss? Well, now it looks like that's finally changing. So what the program actually is. Right now, what's being discussed is something called the Medicare Bridge Program, Medicare GLP-1 Bridge Program. Essentially, it's a temporary, not a permanent, pilot program designed to help expand access to certain GLP-1 medications. So again, it is temporary. This is not a permanent thing. It's set to go into effect on July the 1st. It was originally supposed to run through the end of this year, 2026. Now it's supposed to go through the end of 2027. So we'll have roughly a year and a half. It's only certain medications. It's not Ozempic. The medications are going to be Wegovy, I'm sure you heard of, Zepbound, you probably heard of, and then another one, Foundeo, is one that I haven't seen really a whole lot about, but it's one of the ones that's on the list. Not everyone qualifies. There are some qualifications we'll hit on in just a second. And then, of course, medical approval and then the prioritizations appear to be a little bit different than we're used to. So here's what I want everyone to understand. This is not Medicare suddenly saying everybody gets a GLP-1. You have to qualify. Based on what we know right now, eligibility is number one, you have to have a Medicare Part D plan. So if you have a Medicare Advantage plan with a Part D, or if you have a Medigap with a separate Part D, you're good to go. I feel it's kind of crummy, but the folks who are being left out of this almost certainly are people with TRICARE. Even if someone with TRICARE has a Medicare Advantage plan, they very rarely get one with a drug plan built in, because up until this point, Medicare's had better drug coverage. So it's kind of crappy that veterans being left out. So again, you have to have the prescription drug plan. You also have to fall within certain BMI requirements. So if you have a BMI greater than 35, it looks like you just qualify. If your BMI is greater than 30, you have to have diagnosed heart failure, uncontrolled hypertension, or a kidney disease. If you have a BMI of 27 or greater, you have to have had a previous stroke, be pre-diabetic, a previous heart attack, or peripheral arterial disease. So I know a lot of people have said for years BMI is old, it's outdated, it doesn't make sense. So like I said, I've been on GLP-1 for a little over a year now. I'm now probably in the best shape of my entire life. According to BMI, I am still overweight. I would still qualify at the 27 plus, I think 30 plus, because BMI is so out of date. This is one area where that's actually probably a good thing because it'll allow more people to qualify. So prioritization also will almost certainly be involved, and it's going to be not through your doctor, but it looks like at the pharmacy from what we can tell. And of course, your doctor's going to have to document the medical necessity. Do you fit the requirements? So your doctor may need your original BMI from when you first started medication, not your BMI today if you've already been on it. So if you've already lost weight on GLP-1 and technically no longer meet the number on paper, your doctor may go back through your chart and document where you started. In other words, this probably won't be a situation where you simply ask for it and you get automatically approved. So what if you've already taken one of these medications? This is a question I've gotten actually quite a bit already from our current clients. So what if you're already taking Ozempic, Wegovy, Zepbound, or some other GLP-1 formulation? If you're already taking one for a diagnosis that meets Medicare's criteria, and you don't have another condition that would qualify for it, you're going to get pushed back to your Part D. Now the good news is once you've met the deductible on all these plans, it is rather low cost. We even have one plan here in Florida where once you met the deductible, it's $11 for the Ozempic. So if that's you, stick with what you have. But if you have a different qualifying condition, cardiovascular disease, BMI, whatever, that could still help you qualify for the Bridge Program as far as we know at this point. Again, if you are already taking it, you don't have a different condition, you'll just get pushed back to your Part D. Historically, Medicare has covered some GLP-1 medications for diabetes and heart-related conditions, but not obesity itself. So your diagnosis really does matter here. And here's the part no one's talking about. This is the stuff that I think is going to run with people, a lot of people have issues with, and really no one's discussing yet. The paperwork for prioritization could be sent to the wrong place. It does not go through your regular Part D. It's going to go through a different government processor, and doctors' offices, many of them won't know this, and they're going to try and send it to the Part D first. As far as we understand, it's going to be processed to prioritization at the pharmacy. So that's where the approval process may start, is at the pharmacy. So your doctor will send the prescription like normal to the pharmacy, but when you get there and fill it, that's when that process will start. Meaning your first fill could be in limbo while we wait for this new system that's probably going to be absolutely inundated to process these approvals. And at this point, there's no information about what happens if you're denied yet. So we don't know what is going to happen because nothing's been published. It's still a lot of unknowns about this whole situation. And so here's another thing. If you qualify for what's called LIS, or extra help, low income subsidy or extra help, the assistance doesn't apply to the Bridge Program. So if you meet the qualifications for income and asset qualifications for extra help, but you qualify also for the Bridge Program, you're not going to get the low-cost medication. You'll have to pay whatever the cost is for those prescriptions. And again, this whole process is brand new. Doctors and pharmacies will be learning it in real time as it rolls out. I would absolutely expect confusion early on, and I almost certainly expect some delays. So here, I can already tell you exactly what's going to happen. Your neighbor or somebody's neighbor, your friend, whoever is going to say, Medicare covers all of those weight loss shots. Let's go get them. And people are going to get frustrated when they realize there's still rules, just like the government. There's paperwork, and of course, the government likes to delay things. So here's where we need to be just completely fair and balanced. Medications are powerful. They're not magic. What they've done as far as weight loss goes is they can help with mobility. They can improve blood sugar. They can reduce inflammation. They can reduce potential cardiac benefits. But of course, lifestyle matters. So I'm going to share my own here. So when I started on GLP-1, I was about 295. I was working out, but I wasn't able to do really many super hard things. My A1C is down. My resting heart rate is down from the mid-80s to the mid-60s. And I was just able to run a 5K and do the MRF. The MRF is a memorial battle for a Marine. It's a very hard workout. I was able to complete it. So I stayed active through all of this. And that's something your doctor's going to tell you when you go on it. You have to stay active. You have to at least start walking. If you have Medicare, and if you have a Medicare Advantage plan, it almost certainly is going to have some version of Silver Sneakers, Renew Active, Silver and Fit, some sort of gym membership should be built in that you'll have access to. So your doctor is, of course, going to talk to you about staying fit, staying active, even if it's just walking around your house, around your neighborhood, on a treadmill, or if you're able to get into a pool at a gym near you through your Silver Sneakers, that's ideal. And of course, there's medication interactions. If you're taking the medications it could interact with, that's probably not the best thing. And then I'm recording this on a Monday. Friday last week, I got a call from somebody who wanted health insurance that day to go to the emergency room as soon as we were done. Well, number one, that's not how any insurance works. Doesn't have any health questions anyway. He had taken a shot of Wegovy and he was feeling bad. It made him very, very sick. So that's why it's important to go through your doctor. Make sure that your medication you're getting is, of course, legit. You got it from a family member. But that way, if there's an interaction, you have a doctor to go to. You're not just taking it off the street, as they say. And muscle loss is definitely a concern. So, you've got to stay active. And that's something your doctor will definitely talk to you about. So it is a temporary program. Right now, it's slated for 1.5 years. That could always change. I wouldn't count it getting shortened. It could potentially be extended, but we just won't know until it happens. So what I would do if I was already on Medicare, number one, talk to your doctor. Get an appointment scheduled now, because I am sure their calendar is going to fill up with everyone wanting to get the weight loss medications. Of course, when you get there, you're going to discuss the benefits and the risks. Discuss if your current diagnoses and BMI qualify for the ability to get the GLP-1. They're going to review your prescription medications, make sure there's no conflicts that's going to make you sick. And of course, prepare for delays. This is a brand new program. There's going to be confusions at the doctor's office, pharmacy, the whole program, how it actually gets rolled out. When you're looking for details, so there will be lots and lots of posts on social media. I'm sure some will be great, some probably not so great. So where I got this information for this video is directly from cms.gov, the press release from the government, and from the National Council on Aging, two very reliable sources. So when you're reading about about this program, really anything else Medicare or retirement related, make sure it's coming from a reliable source. So of course, stay updated. We'll put up more videos as we get more information, but watch for information from your Medicare plan, your Part D, and then anything else from the government. So here's my opinion, and really interesting step, because diabetes is tied to so many chronic health conditions that we see in retirement. And Medicare can help improve mobility, reduce complications, avoid potential bigger health problems. That could really make a lot of difference and frankly save lives. Also though, your expectations need to be realistic. This is not Medicare opening the floodgates for unlimited weight loss medications for everybody. There are qualifications you have to meet. There's paperwork, there's approvals, there's the government, so there are going to be delays and potential changes over time. If you are taking these medications, don't automatically assume this program will lower your costs. In some cases it might, in some cases it not. Bottom line, this could be helpful for a lot of people. I think the rollout is probably going to be a bit messy. So stay informed, don't assume every headline you see tells the full story. And so I can already hear people saying, Medicare covers weight loss shots now, and get excited and frustrated when they realize there are still rules. So if you want to avoid that headache, grab my free GLP-1 checklist. I'm going to put it in the section down below. It's a simple one-page guide that helps you figure out if you may qualify, what happens when you're taking these medications, and what to check for before you start making assumptions. Thank you for joining us. Do me a favor if you haven't already, like the video, comment your questions or thoughts, and subscribe to the channel. And we can't wait to talk to you soon.